fatal, but usually it is self-limited disease. Chronic hepatitis A does not exist. Very, very rare or does not exist. So chronic hepatitis A, not existing or very rare. You can see this curve, as you know, when there is infection. First of all, there will be IgM production, serum. After clearing the infection, other class of antibody against hepatitis A, serum IgG. Serum IgG, it means past infection, recovered from infection. So if you would like to detect acute or recent hepatitis A, you have to look for IgM against antihepatitis V. If the person has got G antihepatitis V, it means it is an old infection, past infection, protected person. Also after vaccination, IgG will be generated against antihepatitis A. This acute state, the red one, when there is IgM against hepatitis A, it is associated with viremia. The virus is present in the feces. Jaundice, as I said, patient may have symptoms like fever, malaise, headache, etc. And ALT, the liver enzyme will be increased, ALT. You have also to pay attention to this graph. 90% of developing countries are positive for this virus because it has been infected. 50% of them has been infected subclinically. It is very common. But nowadays, with the availability of the vaccine, it's becoming rare and rare, okay? So vaccine, I recommend vaccine to all individuals, to all children, because it is very important to protect them. It is very communicable condition, infectious, as I said, infectious hepatitis. Now, immunization, you can use passive, already, immunoglobulin, immune serum globulin, ISG, which is a protective if any individual exposed to the infection. When you use ISG, immune serum globulin, this can protect the individual. The vaccine, the active vaccine, activated, which is very important, either can be given alone or with hepatitis B virus vaccine in 3 to 4 doses to adults above 18 years. So for children, one can use killed vaccine. Adult above 18 years can use the inactivated. Now, the inactivated can be given also post-exposure as the immune serum globulin in similar way. Hepatitis B virus, the second one, we finished with A. Now we are going to talk about B. B is very important virus. It is common in the Middle East. Some population, some countries have about 5% infection among the population. كل 105, maybe less, maybe 2, 3, 4%, maybe higher, 6, 7. But on average is about 5%. It is Hepadnavirus, called Hepadnavirus. Hepa from DNA with virus, double-stranded is the B. So Hepadnavirus. The family, Hepadnaviridae, All families of viruses end with suffix viridi. Once you see viridi, it means virus. So Hepadnaviridae, the family of the virus. It is enveloped virus, so surrounded by envelope. We said A and E, non-enveloped. There are 4 serotypes here. The DNA is double-stranded, as I said, but partial. There is an area of it single-stranded. I will show you that area in a moment in the figure. There are 8 genotypes, A to H, based on the nucleotide sequences. These genotypes, very important epidemiologically, not from microbiological point of view, because they are variable geographically. In each country, different genotype. Now, the smallest human DNA virus is hepatitis B from genomic point of view. Now, this virus has got DNA polymerase, which is called reverse transcriptase enzyme. So DNA polymerase, which is reverse picture is very important, and one of the important things that it will keep with you for a long time, because the clinical practice about hepatitis viruses, especially the B, depends on this diagram. I will explain it to you. This virus, this is the genome here, double-stranded DNA. But there is an area only single-stranded. That is why we say partial single-stranded here, only single line, right? This is the polymerase here, the viral DNA polymerase, which is called reverse transcriptase. Now, this DNA is surrounded by the capsid. The capsid contains the core antigen, hepatitis B core antigen. Look how we write it. Hepatitis B, small c here, core antigen, Ag antigen. So you should know this point, how to write core antigen. This is not C for the C virus. This C here is core antigen. So hepatitis B core antigen. Also, with the capsid, there is hepatitis B E antigen. Hepatitis B E antigen, this black one here. It is part of the core antigen, but this antigen can be released to the blood. So we can detect it in the blood. The core antigen cannot be released to the blood. Okay. Envelope, when we said envelope, this is the envelope. Now, the DNA and the capsid, we call it a nucleocapsid, viral capsid. And you should know by now the structure of the viruses. The envelope, hepatitis B antigen, this has been explained to you in your general microbiology. The virus has got envelope, and on the envelope, there are antigens which are called hepatitis B surface antigen, hepatitis B surface, S surface antigen. So in summary, the virus is enveloped. On the envelope, there is antigen called hepatitis B surface antigen. The virus has got capsule, which is the core antigen, hepatitis B core antigen, and with it, hepatitis B E antigen. So remember, surface antigen, core antigen, E antigen. The virus could be present as spherical or could be present as elongated particles. virions. The particles are called virions. Okay, this is virion, the word virion. Now, the viral
Okay, doctor.
antigens, as I explained in the picture, for the envelope, hepatitis B surface antigen. In nucleocapsid, hepatitis B core antigen, C core. Protein core, which is hepatitis B E antigen, which is of low molecular weight. Hepatitis B surface antigen, you have to remember this wording, is present in the serum and cytoplasm of the infected liver cells. It can be spherical or elongated. The hepatitis B virus DNA, the DNA, it could be detected also in the serum and in the nuclei of the infected liver cells. Epidemiology, just a few words about epidemiology of hepatitis B virus. A chronic carrier state is common. We said in A, hepatitis A is very rare or even not existing. As we said, it can be transmitted sexually by needle, that is to say, transfusion or needle injection, etc., and vertical. What is vertical transmission? Between the mother to the baby. If the mother is infected with hepatitis B, this infection can be transmitted to the baby. So we have to take care how to deal with such cases. Chronicity is common in infants who system to deal with it, so the infection become chronic. There is a strong association between hepatitis B viral infection and occurrence of hepatocellular carcinoma, HCC, hepatocellular carcinoma. Persons who are infected with hepatitis B have 10 times to 300 folds more probability of having hepatocellular carcinoma than non-infected individuals. That is why some people become fearful يخافوا من الهيباتيتس بي. ليه؟ Between infection with hepatitis B and occurrence of hepatocellular carcinoma, although after many, many years. Clinical capsule regarding hepatitis B virus. Previously, it was known as serum hepatitis. Remember, this is serum hepatitis. Why we call it serum hepatitis? Because it is transmitted through injection with serum, blood transfusion, etc. So serum hepatitis. And we said hepatitis A called infectious hepatitis. So the name serum hepatitis just to be distinguished from infectious hepatitis. And it is called serum hepatitis because it is associated with needle and the blood transfusion, a transmission of the infection. Hepatitis B usually is asymptomatic or limited illness with fever and jaundice for a few days to weeks, but may become chronic in 10% of the cases and may lead to cirrhosis and hepatocellular carcinoma. The most chronic hepatitis, just for comparison, is hepatitis C. We said about 85% of the cases are chronic. Here, about only 10% of the cases are chronic, become chronic. Now, let us go to this table, which is very important table. This is one of the most important tables. And always you have to expect some questions from this table and the clinical scenarios. Information which is present in this table in the future in your clinical work. Now, hepatitis B virus, the particle, as we said, it has double-stranded DNA virus. It is called DAN particle. Sometimes we use the word DAN particle to say hepatitis B virus or virion. Okay, the virion of hepatitis B is called DAN particle اللي شفناها بالصورة بالرسم. Hepatitis surface antigen is present on the surface of the virus. It can be spherical, it can be tubular, as we said. Hepatitis core is the nucleocapsid and can be detected by immunofluorescence. Hepatitis E, it is a glycoprotein associated with the core antigen. When present, when you detect it in the blood, for example, it means that this person is highly infectious. When you detect hepatitis B surface antigen in the blood together with E antigen, it means this individual is highly infectious. Now, anti-hepatitis B of surface antigen, the body can form anti-surface antigen, which means a protection against the virus. Also, anti-hepatitis B core, it means that the person has been infected and also present in chronic carriers. And this core antigen could be of IgM class or of IgG class. IgM appears during the acute state, and IgG appear when the infection is old infection or a chronic infection. Anti-E also, we have E antigen, anti-E. So antibody against E antigen, also protective. So simply, you have surface antigen, anti-surface antigen. You have antigen and core antigen of IgM and IgG class. زي ما شرحنا للأي M و G. دائما القاعدة الM acute recent. الG قديم old infection, past infection, chronic infection. Simple like that. Okay? Treatment for the acute hepatitis B supportive. We give usually high calorie diet containing carbohydrate and sugars, etc. Chronic infection, interferon alpha. It can be pegylated or regular interferon. Some interferons are called pegylated. Contain polyethylene glycol, that is why called pegylated or regular. Lamivudine is the main drug. If lamivudine become resistant, the virus to it, you can use a nucleoside analog like entecavir or a nucleotide analog like adivofir. These treatments just broad lines for you. Don't pay attention a lot to them. You have to pay attention to lamivudine. It is associated usually in the treatment of hepatitis viral infection classically. The aim of the treatment is just to decrease the viral load. There is no cure. You have to remember, there is no cure from hepatitis B. But if the immune system is able in the beginning to stop the infection, that's it. But once it becomes a chronic, there will be no cure. Right? I put this picture to show you the difference between nucleoside and nucleotide. The difference in nucleotide is with phosphate, while nucleoside, a drug like these drugs, there is no phosphate. Nucleoside, no phosphate. Nucleotide is with phosphate. Remember these drugs. You are going to deal with them next year, inshallah, when we will talk about I will give you such a lecture, inshallah. إذا إذا بقينا إن شاء الله أحياء بعون الله. Now, nucleoside analog, entecavir, and the nucleotide analog, adivofir. Just remember these names, very nice names. Prevention of hepatitis B, we have to screen the blood and the blood product for hepatitis B surface antigen and anticore antibody, which tells you the infection. Expose a newborn baby, vertical transmission or adult, we can give hepatitis B immune serum, hepatitis B immune globulin, which is passive immunity. أجسام مضادة جاهزة تعطي حماية لفترة مؤقتة بس على ما تمشي الأمور وتعمل معاها فاكسينيشن معاها حتى على ما يخلص هذا الاميونوجلوبولين ينتهي الفاكسين يكون قد أنتج antibodies. The vaccine, it is very important. I recommend the vaccine of hepatitis B for all of you. يعني أنا أطلب من كل طالب أن يأخذ هذا الفاكسين قبل ما يداوم بالمستشفيات سنة رابعة إن شاء الله السنة القادمة. كلكم لازم تأخذوا هذا الفاكسين لأنه هذا الانفكشن hepatitis B viral infection is very common as we said, right? And you may get such infection when you go to hospital. So vaccination is very important to all of you. Now, recombinant vaccine, it is recombinant. It is from DNA technology, very safe. It is not a real biological agent. It is a recombinant vaccine. It can be given in 3 doses, day 0, 1 month, 6 months, intramuscular. This vaccine can be given with other vaccines, such as HEV conjugate, Haemophilus influenzae type B, not less than 6 weeks of age, not more than 6 years of age, or with DTaP, not less than 6 weeks of age, not more than 7 years. That is to say, not less than 6 weeks, it should be given after 6 years. This one here, not given below 6 weeks, but should be given after 7 years, okay? Can be given after 7. Now, Delta virus or D, stranded circular RNA, negative sense virus. This virus so cannot live alone. It depends on B, as I said, requires the presence of B antigen in acute or chronic stages. Persons who are infected with this Delta virus, okay, with B, it becomes very dangerous. It has more mortality and morbidity rate. They share together the envelope, co-opt envelope, يعني share the envelope between them. Transcription, replication occur in the nucleus using the host cell RNA polymerase. Treatment and the prevention depends on the B. Now the C, single-stranded positive sense enveloped virus of 11 genotype. من هال 11 genotype, only 1 and 3 are worldwide. The transmission of hepatitis C, of blood and blood product by needle and sexual. Also associated with hepatocellular carcinoma in chronic hepatitis C infection, also associated with hepatocellular carcinoma. The presence of certain antigens also may make the individual more prone to develop hepatocellular carcinoma. The virus structure is this one, single-stranded RNA. This is the core protein here, and this is the envelope. Now, the envelope has got certain antigens, E1, E2. This is the envelope, the blue one. And these can be used as receptors to catch the host cells, to enter through the host cells, through these glycoproteins. They catch host receptors, and through those receptors, the virus can enter into the body. A clinical capsule, hepatitis C is the most insidious, very slowly. 85% of them, they become chronic. So the individual does not sense that they have got infection. And the chronicity is very characteristic of the virus. And hepatitis C can be transmitted with the blood transfusion, etc. But nowadays, because of the presence of screening tests, we test for them, فحوصات تبين الشخص مصاب ولا لا. And now this infection becoming rare and rare, more rare, because we don't take any blood without screening to hepatitis C. Manifestation of hepatitis C in incubation period, as I said, is long one, 6 to 12 weeks, maybe more. Acute, not apparent. 75 anicteric. The word anicteric, it means without jaundice. يعني 75% من الناس اللي ينصابون بالسي ما يبين عليهم jaundice اللي حكينا عليه. 85% chronic. How we diagnose them? By ELISA, enzyme-linked immunosorbent assay. We detect anti-hepatitis C antibody. شوفوا هون السي مو كور. Anti-hepatitis C antibody. We confirm the test by technique called REBA. Also can detect anti-hepatitis C antibody. Also, we can detect the virus itself by real-time PCR. And by detecting the viral load, we can diagnose and follow the treatment of the patient. So for diagnosis and follow-up by real-time PCR. Treatment, acute may resolve spontaneously. If not, combined therapy we use. Also interferon. Now the drug here, the main drug is ribavirin. لاميفيودين حكينا بالبي. هسه ريبافيرين. وحتى مرات واحد يقول لك هذا المريض ده ياخذ ريبافيرين، معناته احنا ده نحكي تقريبا على الهيباتيتس سي. من يقول لك هذا المريض ده ياخذ لاميفيودين، احنا كانما ده نحكي على الهيباتيتس بي. Okay, so this combination, interferon and ribavirin, which can be given orally, of course, for genotype 2 and 3 for 2 years. For genotype 1, which is more aggressive, we can give it for 48 weeks. Sorry, not 2 years here, 24 weeks. And here we give it for 48 weeks. Okay? 24 weeks and 48 weeks. There are new drugs which are a nucleotide or a protease inhibitor, sofosbuvir, Sovaldi, Rivadavir. ممكن واحد يسألني دكتور هاي الأسماء نحفظها؟ لا ما نحفظها. Just knowledge for you. Just a preparation for you for next year إن شاء الله. هي والتبع الهيباتيتس بي. فقط 2 drugs أريد من عندكم، الريبافيرين واللاميفيودين. أوكي؟ ريبافيرين واللاميفيودين. بقية الدراجز just for knowledge. Now, hepatitis E, Resemble A, can be transmitted by fecal-oral route. Positive sense, non-enveloped RNA oral fecal route through food and drink, replicate in the cytoplasm, in incubation period 4 days. Fulminant hepatitis E occurs in a pregnant woman. Remember this word. The most important point I would like to stick it in your mind regarding hepatitis E virus is that this virus, when infection occurs in a pregnant woman, fulminating, killer, no treatment for it. Diagnosis, you look for IgM antibody for the acute. Real-time PCR to detect the hepatitis E RNA. This is for research work, not for routine hospital work. What we give, supportive treatment. Immune serum globulin does not provide protection. May need liver transplant because it is very serious. And good sanitation and prevention. Now, hepatitis G, and hepatitis, look, HBGV, it means a human persistent G virus. Sometimes it is given GBV. GB surgeon أول جراح انصاب بهذا المرض called G. Baker. فلهذا السبب G. Baker virus. C because it is similar to the C virus. It is envelope RNA positive sense, a transmission parenteral similar to C by a blood transfusion. The role in human disease is uncertain. Co-infection with C does not worsen the condition. The interesting point that infection with this virus inhibit HIV virus, so prolong the life of AIDS patient. This point is under research. يعني الشخص اللي ينصاب بالجي يعمل inhibition لل HIV virus, a human immunodeficiency virus. This point is very interesting. Keep it in mind because it prolonged the life of HIV-infected persons. Lastly, the new hepatitis viruses, which we call them non-A to E hepatitis, we have 2 types, SEN virus and TT virus. Both are enveloped, single-stranded DNA viruses. The clinical importance of these infection occur with the blood transfusion and occur with kidney dialysis. في غسيل الكلى، أجهزة غسيل الكلى. وذول ال 2 viruses newly discovered. Diagnosis by PCR, and you know what is PCR, and the treatment is similar to hepatitis C virus. By this, we end this lecture. Any question? Any student who has got a question, please do ask. حمزة معاي؟ Any student؟
دكتور
نعم.
لو ترجع على المخطط، على أول مخطط.
نعم. نعم. شو المخطط تبع ايش بس وضحي؟
المخطط اللي فيه IgM والIgG.
تبع هذا.
أيوة، بس بدي أفهم ALT والأول واحدة كمان الفيريما.
فيريميا يعني presence of the virus in the blood. هاي معناتها فيريميا
تمام.
بالانفكشن. واي ال تي واحد من الليفر انزيمز اللي يزيد. اوكي، انزيم ليفر انزيم، مو الليفر cells becomes infected, so this enzyme is increased. It's called ALT. وفي انزيم اخر called AST ALT. Okay, clear?
تمام.
Right. Any other question? Okay then. Now the record. Now we have to stop, and the record will be preserved automatically. مو صحيح؟ مين يعرف بها هذه؟ حمزة ما معانا؟ Okay, so we have to stop here and end this seminar. Okay?